All right, so welcome back everyone. As you see in our last video, we spoke about the sort of approaches in reversing arthritis from a chiropractic end, but a functional medicine end as well. And in this video, we're going to talk about the testing as we previewed with Dr. Ryan. And Dr. Ryan has a very specific approach when it comes to testing and imaging for conditions like arthritis, because as we know, Dr. Ryan, everyone's imaging testing will be a little bit different, and based on that, that's how we can really give a proper assessment and a plan to fixing it. So Dr. Ryan, someone comes to you with arthritis for the first time. What is your approach in terms of using this testing to really give you that deep insight into their body, which leads to creating the plan for you?
The first and most important thing is looking at their current biophysics or biomechanics. Osteoarthritis, forget taking out the metabolic component just for right now, because there's no such thing in the human body as a textbook answer. Nutrition plays a huge role. Let's pretend it didn't for a split second, and we're only going to focus on the biomechanics of your body. What does that mean? Biomechanics is how does your body move compared to how it's supposed to move and function. If your body's bent and twisted, that means you don't have a healthy spine, but more importantly, you're not going to have good biomechanics. Those joints are taken to their end range and they're not going to move properly. Now we're also going to be specific in this video about the spine and osteoarthritis in the spine and very close by proximal joints. Not talking about knees, we're not talking about ankles right now. In the spine specifically, we have to see your biomechanics. So how we do that is we use a couple different tools. The easiest, quickest method is digitized postural analysis. And we do all that in the clinic. What we do is we take a couple pictures and we plot specific points on your body where if you were to draw a plumb line on a person, they should be straight up and down. And we mark different points. Okay, and then when they're facing the front of us, a plumb line should drop directly straight through the middle of your body. You shouldn't be deviated like that, right? That's not normal or healthy, and which means you can't move normally or healthfully from that position either. So that's the digitized posture analysis. It's extremely critical. It's something that we can easily, quickly do. And the huge benefit is that you don't have to be in the clinic for us to do that. For people that aren't local and still want help with things, we're going to do it more of like a consultation basis, more like a coach basis. You can send us the pictures, we can do that analysis, and we can build a rough care plan for you based on that. Ultimate test though is to actually come into the clinic where we're going to do a full evaluation, including the digitized postural pics. And then we're going to take a series of images, and what I mean by images is x-rays, or what you've heard of called radiographs.
Yeah.
Why are we going to take that and not just rely on the digital pictures? Well, we are going to use the digital pictures as you go through care, because you're going to see that as you go through care, your posture will start to change externally. But internally, we need to make sure that those spinal joints, each individual spinal joint is also moving properly. Eventually, after you're, like you heard in the other videos, 4, 5, maybe 6 months into care, we do an updated set of x-rays. Well, we're going to do a bunch of re-exams as you go through care, roughly every 4 to 6 weeks or a little sooner, to make sure you're still progressing. We are not going to take x-rays every 4 weeks, right? It just doesn't make sense. The body doesn't structurally change that fast either. Here I have my tablet. I have it, a John Doe, a de-identified patient example of what do the x-rays actually look like that we take in the clinic, or that we have analyzed and utilized in the clinic. This is a perfect example of a neck, okay? And without going to excruciating detail in this video, just know that I would go in with an in-depth analysis on why is your neck curve completely the wrong direction, like in this video, or in this image here. This is an x-ray. The reason we do all these different pictures and images of the actual spine itself is to see over the years, or after one car crash, these things can happen. We want to see how long has it been there, and I can tell a lot of that information simply by looking at your x-rays. I can't tell you the countless number of patients that said, I've never had a serious injury. I go and I look at the x-rays, I say, hey, I know you don't remember what happened, but this injury looks maybe 20 years old. And they're like, wow, okay, now I do remember.
Yeah.
I fell when I was 16, or I was in a car crash when I was 16. And I was like, yes, that makes a lot of sense, because you can tell, and we're talking about osteoarthritis, you can tell certain levels of degeneration, and maybe I'll find a nice picture here. You can tell certain levels of degeneration simply by looking at the x-ray. That's where all those metabolic components that shouldn't be there started to accrue. Calcium deposits start getting laid down. Yeah. And much of this is because the structure's off and unhealthy, but also because the person's not eating well and moving well. This is a perfect example here where you see very, very minimized disc space. Now that's not a genetic thing, because if it was genetic, then what do you think the rest of these vertebrae would look like?
They would be all the same.
They would be all the exact same, because it's the exact same person. And sometimes I joke with patients, hey, if your other provider told you your spine decays with age, then how old is this disc? How old is this vertebrae? And then how old is this one?
Right.
And sometimes it takes them a couple seconds, and then they answer and they're like, oh, wait, that makes sense.
Yeah. Yeah. So it sounds like really, Dr. Ryan, what you're telling us here, that imaging goes beyond just seeing what your body's like for that day. It might actually uncover a whole health history that people might not be even aware of, like you mentioned. And I think that's really amazing, because I think for a lot of people, especially with arthritis, right, it doesn't happen overnight, but sometimes, if you mention those traumatic injuries that people might have forgotten, it might be still there. And using it, and using also what you've mentioned, the digitized posture assessment, you can really create a foolproof plan for them, right? Because now we actually know what's going on inside the body from that structural, from that physical level, right? So using these assessments, it sounds like patients are more successful in their care protocol than without it.
They're definitely more successful. And on top of that, we live in a society where, stay tuned for a different video where we talk more about energy medicine, but we live in a society where they want to see things. Right. And operating from that perspective, these are things that the patient can see. When I tell them why they've had sciatica off and on, well, the injury didn't go away the last year that you felt amazing. You've just not been doing something that you were able to do before. You've stopped lifting weights, you've stopped running, you've stopped doing all these things, but now you're still feeling okay. You slipped and pulled your back out yesterday. Well, I can promise you that sciatica injury has been there the whole time. And that's just another perfect example of, we can see what's been going on.
Yeah. Yeah. So I think, as Dr. Ryan has mentioned, it's something that might pop up. You think like, oh, I didn't do anything. It just kind of came up. But there's a whole breadcrumb trail into your past and history. Again, with the proper assessment tools that Dr. Ryan has mentioned in this video today. So if you've enjoyed this video, I think Dr. Ryan is an expert, clearly an expert in this field. So please feel free to look at the link in our description for all the contact information for Dr. Ryan for a consultation. And even like you said, if you're not local, Dr. Ryan can still take care of you from a more telehealth perspective and looking at, you know, the digitized posture assessments and things like that. And he can go over your past imaging as well. So Dr. Ryan, anything else left for this video?
I think that's it in a nutshell. The most important thing I would like everyone to take away is that you have way more healing capacity left in your body, left in the tank, and you do have the ability to heal and recover. You just have to be willing to put in the effort and take action.
Yeah. Yeah, and that's a big part of my motto too, in terms of taking charge of your health versus following someone else. And I think about what you've mentioned in this video, really taking action with the right assessment, with the right testing, and seeing your health history is such an important start to that. So thank you so much, Dr. Ryan. It's been a great video, and we'll see you in the next video.